Hi everyone. So our team will be presenting on the satisfaction performance theory today. And in this presentation, we will explain the main idea of the theory, discuss its key components, and show why it's still relevant in the workplace and healthcare settings today.
In our first slide, we will be introducing the theorists and defining the theory. We chose the satisfaction performance theory, which is also known as the Porter-Lawler model, which explains how employee motivation, performance, rewards, and job satisfaction are connected. The theory suggests that employees become satisfied after they perform well and receive rewards that they believe are valuable and fair. This theory was developed in 1968 by Lyman Porter, and Edward Lawler. Both researchers basically specialized in organizational behavior, employee motivation, and management. They wanted to better understand what motivates employees and how motivation affects their performance and job satisfaction. Their theory expanded on Victor Room's expectancy theory, which focuses on how people make decisions based on the rewards they expect to receive. Porter and Lawler agreed that rewards are important, but they believe that there was more to the relationship between motivation, performance, and satisfaction. The main idea of their theory is that employees do not perform better simply because they are happy or satisfied with their job. Instead, they believed that employees become satisfied after they perform well and receive rewards that they feel are valuable and fair. So the key takeaway from this theory is that good performance leads to rewards and fair rewards leads to job satisfaction. This is different from older theories that suggest job satisfaction comes first and then leads to a better performance. In the next slide, we are going to look at the key variables in the Porter-Lawler model and how they all work together. In this slide, I have written down all 10 variables and their definitions. The first thing employees think about is whether the reward is worth the effort. For example, they may ask themselves, is this raise, bonus, or recognition important to me? They also think about whether they believe working hard will actually help them earn that reward. If they believe that it will, they are usually more motivated to put in the effort. However, effort alone does not guarantee good performance. Employees also need the right skills, experience, and a clear understanding of what their job requires. When you have way too many job requirements and it's not actually effective or it's not actually in your job description, some employees will get confused. But after employees perform well, they can receive two types of rewards. The first is intrinsic rewards, which are internal rewards like feeling proud of their work, accomplishing a goal, or growing professionally, or growing professionally. The second is extrinsic rewards, which are external rewards like a raise, bonus, promotion, or recognition from their supervisor. Finally, employees ask themselves if the rewards they receive were fair based on the work that they put in. If they believe the rewards were fair, they are more likely to feel satisfied with their job. So this model shows that motivation, performance, rewards, and satisfaction are all connected and work together. For an example, I had a move in my job where we moved offices, and off the clock we literally moved the whole entire office from one office to the other office, and it was during Christmas time, and all the employees put in that hard work. They used their own car, which means there's their own mileage, their own gas, and when the Christmas bonus came along, they did not receive a Christmas bonus, which made everyone at the job feel very unappreciated, and they definitely were not satisfied with their job. In this next slide, you will see a diagram that shows how the Porter-Lawler model works step by step. The process starts when employees believe a reward is valuable and that working hard will help them earn that reward. This motivates them to put in effort. However, effort alone does not guarantee good performance. Employees also need to have the right skills, experience, and a clear understanding of their job responsibilities. When employees perform well, they receive intrinsic rewards like pride and accomplishment, and extrinsic rewards like pay, bonuses, or recognition. They then decide whether those rewards are fair. If they believe the rewards are fair, they become more satisfied with their jobs. The main takeaway is that performance leads to rewards, and fair rewards leads to job satisfaction. This is what makes the Porter-Lawler model different than earlier theories.
The satisfaction performance theory was developed in 1968 by Lyman Porter and Edward Lawler. The history leading up to this theory being developed began in the 1930s when the human relations movement arose. During this time, the Hawthorne studies were led by Elton Mayo, and they helped show that employee productivity is influenced by workplace relationships, social dynamics, working conditions, and overall employee well-being. Then, as time went on, in 1964, Victor Vroom developed the expectancy theory. This was a more mathematical-based approach, and he stated that motivation was based on expectancy, instrumentality, and balance. That employees actually mathematically calculate whether the efforts that they put in will lead to their valued rewards. Following Victor Vroom's expectancy theory in 1968, Lawler and Porter came up with the model in their book, Managerial Attitude and Performance, where they challenged the known idea that happy employees perform better. Instead, they argued that performance can lead to satisfaction when employees are fairly rewarded. Their model expanded on the expectancy theory. It explained that employees are satisfied when they perform well, that they receive rewards for their work, and they believe that those rewards are fair. So what impact did this theory have on organizational behavior? Well, it changed how managers understand motivation. They understand now that effort leads to performance, which leads to rewards, which then leads to satisfaction. It helped managers see their employees and how they perform. It led them to be able to give both intrinsic and extrinsic rewards. With managers and how this impacted organizational behavior, it allowed for improved role clarity, teamwork, fairness, employee motivation, and overall outcomes within the workplace community. The idea challenged that satisfaction alone does not give good performance, and it really has led managers to lead their teams better, perform trainings on different groups, and allow those social dynamics to come together in the workplace. So how has this theory evolved over time? Well, it's expanded through research and other models being used. Instead of just the Lyman Porter models, others are being used to expand that effort, performance, and fair rewards do in fact lead to employee satisfaction. There's been research on fairness and alternative models which have caused the theory to expand and be used more widely in a sense of employee workplace. The model helps managers to improve motivation within their employees. It can lead to improvement in role clarity, teamwork, equity, patient outcomes, and overall community well-being. So is this theory still being used today? Well, in a way, yes, it is. Employees receive bonuses, raises, they get employee recognition, promotions, sometimes they have team lunch or team dinners. So yes, in a way, this theory is still being used today.
Hi, my name is Christine, and for this discussion, I'm going to start talking about the relevant research evidences. So for study one, this 2022 study focused on the healthcare professionals in Shenzhen, China. So the researchers used a quantitative online survey with cluster sampling, and they collected data from 1,200 employees in the Nanshan Medical Group. The results show that job satisfaction was positively related to job performance. So employees who were more satisfied generally performed better at the job. So the study also found that the lower burnout was linked to higher job satisfaction. And then overall, the study strongly supports the satisfaction performance theory because it suggests that job satisfaction improves performance not only directly but indirectly through the lower burnout and stronger organizational commitment. So the key takeaway is that Workplace conditions really matter in helping satisfaction translate into a better employee performance. Moving on, we have study 2, which focused on the critical care nurses in Jordan 2025. So this study examined whether work engagement changes the relationship between job satisfaction and performance. Now, to test this, the researchers used the descriptive cross-sectional correlational study, and they collected data through the online questionnaires. The sample included 143 registered nurses from the 4 public hospitals in Jordan. The main findings showed that job satisfaction has a positive relationship with job performance. However, it is not significantly related to the performance frequency. The study also found that work engagement significantly moderated the relationship, which means the effect of satisfaction on performance was stronger when nurses were more engaged in their work. So overall, the study gives a partial support to the theory because it shows that job satisfaction matter, but in high stress healthcare setting, its effect on performance is stronger when employees are highly engaged. So the study adds an important point. Workplace engagement can strengthen the link between job satisfaction and performance.
Study 3 is based off the phrase happy worker, productive worker. Fisher examined whether individuals believe the phrase. It suggests that employees who are happier or more satisfied with their jobs perform better than the less satisfied individuals. In this study, there were 3 different groups: 176 supervisors and managers in a hotel chain, 106 first-year undergraduate students at an international university, and 156 engineering students from a public university in the U.S. The studies use a cross-sectional survey method. The questionnaire was 6 opinion-based questions using the 7-point alert scale, ranging from strongly disagree to strongly agree. Question consisted of happy worker is likely to be a productive worker, and those who dislike their jobs tend to perform badly at work. Or I genuinely work harder and better on tasks I enjoy than on tasks I dislike doing. In study 3, Fisher concluded that most participants believe employees are happier or more satisfied with their jobs tend to perform better. However, this study measured people's belief rather than whether the theory is actually true. While study 3 examined whether people believe in suffocation performance theory, study 4 tested whether the relationship between suffocation and performance existed in the workplace. The study included employees from 65 different organizations with no more than 12 employees from each. In this study, alarm watches were utilized. The alarm was scheduled to each participant's work hours, not cutting into their break times. It ranged from different periods each day. Each signal they had to answer to current feelings and activities. 68% were answered immediately, and 79% were answered within 2 minutes to highlight and ensure accurate reports on feelings and behavior at the time of the reporting. Fisher concluded that the study found little evidence that overall job satisfaction was related to overall job performance. Correlations between job satisfaction and job performance were 0.10 or lower and not significant, suggesting that employees who were generally more satisfied with their job were not necessarily better performers. However, when employees reported how they felt during specific work times, the relationship was much stronger.
Before and after. In my in 350-bed community hospital strongly with peer perform, despite having a skilling healthcare professional and modern technology. The hospital decided to decline patient outcome because employee satisfaction was low. Leadership took the decision to apply the satisfaction perform theory, organizing to improve employee satisfaction or improve organizational behavior. Before, employee satisfaction is very bad. Staff members frequently report frustration Many are nurses working too much overtime. Applying the satisfaction perform theory, the hospital leadership implement several initiatives designed to improve the work environment and employee satisfaction by investing in communication, employee witness, recognition to employee, offering professional development opportunity, promotion employee, etc. After the transformation, employee satisfaction improves, turnover rate reduced, patient satisfaction improve, readmission reduced, financial performance very strong and sustainable.